If you've got a corn or callus on your foot that's causing you a lot of pain, I know you're tempted to grab one of these from your local drugstore, but I'm here to tell you that corn and callus remover pads can make things a lot worse, and they can actually be really dangerous. My name is Dr. Tarr. I'm a board-certified podiatrist in private practice in Phoenix, Arizona, and I actually own a practice called Direct Podiatry Arizona in Tempe. So what we're going to be talking about today, my 4 reasons why you should never use corn remover pads and 4 things you can do instead. Reason number 1, they burn healthy skin. So corn and callus remover pads, we've all seen these in our local drugstores. Maybe you've even bought some online. Most of these pads contain something called salicylic acid. Salicylic acid is commonly found in skincare products, but at lower amounts or lower percentages. It's not that salicylic acid is bad, but at very high concentrations, like corn and callus remover pads, for example, they can do a lot of damage. Salicylic acid, it's an exfoliator, so it makes your body turn over cells a lot faster. Great for treating acne. Salicylic acid, us as podiatrists, we also can use it in treatment with other things for nail fungus, for example. And most corn remover pads contain some sort of salicylic or sal acid. But a lot of times the percentage, you're getting a super, super, super high amount. And because of this, when you put this on your corn, on your callus, the salicylic acid, yes, it is good at breaking down corns and calluses, but salicylic acid is really good at breaking down your normal healthy skin as well. And this is one of the big reasons why corn or callus remover pads definitely can increase your risk of developing sores, holes in your foot, can lead to burns, can lead to open wounds. A specific wound called an ulcer, which is a type of wound in your foot that takes a very long time to heal. It's chronic, and it's really a hole in your foot. This can lead to a whole new problem that you didn't even ask for, just trying to get rid of a corn or callus. When this happens in someone that has diabetes and someone that has poor circulation, known as PAD or PVD, when this happens in someone with neuropathy, this can be super dangerous. With these diseases, they make it a lot harder for your foot, your legs to be able to heal any type of injury, especially skin injury. Wounds on their legs and feet will tend to stay around a lot longer, be a lot slower to heal, and you run into higher risk of developing complications, bad enough that you actually have to be hospitalized, and worst case scenario, amputation. So my second reason why I don't like corn or callus remover pads, the risk of infection. Again, once you have an open wound, an open sore on your body, increases your risk of bacteria, fungi, all type of things now being able to enter that wound. For people with diabetes, poor circulation, neuropathy, chronic kidney disease is another one. A wound on your foot is super risky and potentially life-threatening. My third reason why I don't like corn remover pads is that you might actually be treating the wrong thing. It might not be a corn at all. Corns and calluses on the feet are often confused for a wart, a plantar's wart, because they can look the same on the surface to the untrained eye. Plantar warts a lot of times do kind of form a callus at the top. And so from the surface, a plantar's wart and a corn look exactly the same. If you throw a corn or callus remover pad on top of a wart, you're potentially now spreading that infection to other parts of your foot because, again, you're breaking down that skin where the virus that causes the plantar wart lives, and then you're potentially spreading that to other areas of your foot, maybe your hands, because now you've touched the corn remover pad. Maybe you have a burn from that corn remover pad or callus remover pad. So again, corns and calluses can present as a lot of different things. And when you're treating these things at home, you might not be 100% sure of what you're treating. The fourth reason, they don't solve the root cause or get to the root cause of why you're developing the corn or callus in the first place. With corns or calluses, they happen to feed in a response to pressure in that area, too much pressure, too much friction. And this is how our bodies tries to protect that area, is by building up a callus, which is dead tissue. So that pressure can be coming from the type of shoes that you're wearing. It could be how you're walking. It could be changes to your foot shape. Let's say, for example, you had a quote unquote normal arch and now your arch is starting to collapse. Maybe your arch is starting to get higher or develop higher, and then now you have a cavus foot type. So changes to your foot shape will lead to calluses because now you're asking your foot to take on added pressure in areas that were never designed to take that level of pressure in the first place. People develop corns and calluses too on the tips of their toes if they develop hammer toes, for example. And hammer toes can be very common in people with diabetes. To try and treat a corn or callus, you have to try and treat the changes that are going on to your feet. And sometimes it's as simple as just changing your shoes. Sometimes there's more that will be required. So what should you use instead of corn or callus remover pads? One, if your corn or callus isn't getting better, definitely see a foot doctor or podiatrist. We can do an exam. We can check out your feet. We can also do something called a gait analysis or gait examination where we watch how you walk, how the joints in your feet are moving, how your hips are moving, how your shoulders are moving. That tells us a lot of things. Based on that, we can see which part of your feet are now taking up more pressure than what is normal. We can see maybe if your foot is compensating, if you have any muscle imbalances that are going on. Two, fix the pressure. Shoes that maybe aren't rubbing in certain areas. Padding or even using orthotics at times in certain people can help remove pressure from those areas of your foot that are taking up too much pressure and kind of offloading. That's the term that we use, offloading, removing pressure from those areas. Also, I'm a big fan of muscle retraining, rebalancing, and rehab as well. Strengthening your feet using certain exercises depending on what foot problems you're trying to overcome. So whether it's pain in the ball of your foot, pain from a tailor's bunion, I'm a big fan of using these exercises to get your feet stronger, to get your feet more functional, and to get you out of pain. Number 3, moisturize and exfoliate. If you've been dealing with a callus for a while that is not getting better, one factor to this callus developing is that your skin is very dehydrated. I live in Arizona. The air is very dry here. There's very little humidity. People also wear sandals majority of the year just because it's very warm here. So that sometimes can increase your risk of developing a callus, but being mindful of moisturizing your feet regularly and using a moisturizer that works for you, something that is truly going to penetrate your skin and keep it hydrated all day is really important. Use of a pumice stone also can help too, and this is a little volcanic stone that's sold in grocery stores and pharmacies in the foot health section. It has a lot of pores or holes in it, so it's very light, but it's very good for exfoliating skin. So caveat before I continue, if you have chronic diseases like type 2 diabetes or type 1, neuropathy, circulation problems, PVD or PAD, chronic kidney disease, anything that makes it a lot harder to heal or you're immunocompromised, I would say skip this step because, again, you don't want to create an ulcer on your foot. But if you're a healthy individual, what you can do is you can first make sure your foot is wet. So usually I will encourage patients to do this after they're done bathing or showering when your skin is really wet and hydrated. Take that pumice stone and gently, the word is gently go over that corn or callus. And over time, that dead skin will start to slough off. Also, if you opt to see a podiatrist about your corn or callus going on, we also can prescribe exfoliators that are good enough to help with the corn or callus, but also at the same time won't eat away at your healthy skin. Certain moisturizers we can also prescribe as well. If your skin is super dehydrated and things over the counter aren't working for you, that's an option as well. And number 4, try a non-acid padding. So again, if you're dealing with a corn or callus for a while, because some people, unfortunately, just based on how their feet are shaped, especially if you're diabetic, if you have neuropathy and your foot has undergone changes to its structure, we have to now try and fit that new form of your foot. Non-acid, I'll say that again, non-acid padding is good to use at this point. So again, these pads don't have any acid, any medicine on it at all. It's literally just a foam pad, and that's fine to use. Put that around the corn or callus that's bothering you. And that also can help offload those areas, remove added pressure, remove friction. So do I think corn remover pads are safe for even those people that don't have chronic illness or chronic disease? Honestly, no. I think, again, the reasons because they eat at healthy tissue as well, in addition to the corn or callus, that can increase your risk of being left with some type of burn or sore or wound. I honestly don't think they're healthy for anybody. So I gave you some tips today to manage to treat your corner callus and to step away from the corner mover pads for good. Feel free to leave comments down in the comment section below. Share if you liked this video today and would like to see more content from me. Feel free to subscribe and hit that notification bell so that you will be notified whenever I post a new video. And take care, everyone. Until next time.